Hello, my name is Dr. Robert Jaffe, and I am a licensed marriage and family therapist and certified hypnotherapist in full-time private practice since 1984. I specialize in the treatment of trauma, addictions, and relationships. I want to begin by giving you a definition of trauma and addiction, and then continue with a synopsis of how I became interested in those areas. The dictionary defines trauma as a deeply distressing or disturbing experience. It defines addiction as a complex condition, a brain disease that is manifested by compulsive substance use despite harmful consequences. In my experience, the dictionary definition of addiction is an error. I have learned over many years of study and practice that addiction, rather than being a brain disease, is actually a process that is learned and can be fueled by either chemical or physical changes, which can cause people to want to repeat consistently a behavior that gives them short-term gain with long-term negative consequences. For example, taking alcohol or drugs gives a person relief from anxiety or depression, along with a temporary euphoria which feels positive. After the euphoria wears off, their depression or anxiety returns, along with the down feeling, which is at best unpleasant or at worst debilitating. A process addiction, such as gambling, changes the brain chemistry to release endorphins and other chemicals which serve the same purpose and achieve the same ends as taking alcohol or drugs. With respect to trauma, we now know that trauma comes in two types. One is a major trauma, or large T trauma. The other is a small trauma, or small t trauma. Large T traumas are events or experiences that most people, when hearing of them, would recognize as being highly traumatic. These large T traumas include, but aren't limited to, natural disasters, such as earthquakes, floods, and hurricanes, or through war, or any kind of physical assault, such as robbery or rape, as well as severe losses through death, injury, or divorce. Small t traumas can negatively affect us, even if only occurring one time, however, are particularly injurious when occurring multiple times. Many small t traumas may occur during childhood and may be repeatedly experienced and become pervasive across our lifespan. Examples of small t traumas can include any emotional abuse, such as being yelled at, embarrassed, humiliated, or being treated unfairly. Common small t traumas include girls being treated as if they're not as important as boys, being negatively compared to someone else, being told that your feelings or thoughts don't matter, or being ridiculed for expressing your beliefs or opinions. As previously stated, these may be a one-time event or can be part of a continuing pattern, the accumulation of which can be as serious or more serious than any large T trauma. My passion for my work with trauma and addiction began as a result of my own life story. I grew up in a middle-class Jewish family that, both to myself and to others, seemed average and normal. It wasn't until I went through a divorce at age 30 and entered therapy that I began to realize that there were in fact small t traumas in my childhood. In my case, the small t traumas had to do with my mom's temper. She would scream and yell, and when she did, I always felt confused about what I did wrong. Be aware that children always believe that there is something wrong with them versus their parents, because to believe that you are dependent on people who aren't dependable is too dangerous a thought for a child to engage in. During my therapy, I began to realize the extent to which these small t traumas had affected me. I had developed a sexual and cannabis addiction, which I kept as a secret. It took me a long time to get out of denial and realize that my addictions were having negative consequences. I lost interest in doing things that I used to enjoy, and my motivation was greatly diminished. My relationships suffered, and my memory deteriorated. It was very difficult for me to think that any of this had anything to do with my parents' behaviors. I loved both my parents, and I didn't want to think of them as less than perfect or that their behavior was in any way hurtful to me. After I became a licensed therapist in 1984, I went to work for a drug and alcohol rehabilitation center for the next 24 years. I ran recovery groups, and I worked with individuals and families and provided supervision for the drug counselors. As a result of my study, experience, and my own work in therapy, I learned that our addictions are often tied to large and small t traumas, which, without our understanding, remain locked within our subconscious minds and lead us into compulsive thinking and behaviors, which can consume us. Whether our addictions are to alcohol, food, drugs, sex, gambling, or even television, we can learn to overcome them, not by sheer willpower, but by deconstructing what happened to us and understanding the meaning that we attach to our experiences. In doing so, we begin to free ourselves to return to our loving, authentic, true self, which we can then bring into every area of our lives and our relationships, and our need for our addictions disappears. In my upcoming presentations, I will be speaking more about how our minds fool us into believing that we are okay, and talk more about how we can counter and correct those misperceptions one step at a time. And that's what Heart-to-Heart is all about. If you or a loved one struggle with any kind of compulsive behavior or activity, I want to make myself available as a resource and invite you to contact me either through my email or at my office in Encino. All communication will be held strictly confidential. My email address is dr.jaffe, Jaffe, the number 1, at AOL.com, and my office number is 818-906-7079. Thanks for listening.